Fab. Okay, so so to set the scene a little bit, I mean, 2 years ago at the Royal Free, we started a Joy in Work collaborative, which included 15 teams from across the organisation. Now, the work started 2 years ago, and it did get paused with COVID, but what we really want to tell you about is the collaborative, how we ran it, what we did, what we learned, but also we want to show you how we used and adapted the framework since then as well. So we're going to tell you a bit more than just the collaborative. So to get us warmed up, we're going to just do a bit of a Slido question. So our first, so if you go to slido.com and our code is Joy in Work, so JIW, or you can use the QR code. And we've got our first question for you. So the question is, before signing up for this event, have you heard about Joy in Work before?
And the other thing to think, if you haven't used Slido before, you can just hold your phone over the QR code and it will just pop up as well. That's another trick.
Okay, fab. It looks like, oh, it's moving. So far, 80% of people have heard of Joy in Work before. But we've got 20% that haven't. So that's really interesting. So I'm pleased there's a good proportion of you that will hear all about it as well. Okay, so we'll move on to our second question. So my organisation uses or has used the Joy in Work framework before. So this is really interesting. So lots of people have heard of Joy in Work, but the number of people who are actually using the Joy in Work framework, it's kind of flipped. So we've got about 20% of people using the Joy in Work framework and near 80% that haven't. Okay, let's go for the next question. So thinking about, reflecting on the past 18 months that we've had, even in this time of crisis, I've found some joy or satisfaction in my daily work. 1 being strongly disagree, 10 being strongly agree. So this is a really interesting one. So we can see that, that's what, about 60% of people to maybe 75% of people really do agree that even what has been an incredibly challenging year, we've still been able to find some sort of joy in our work. Okay, next question. In one word, what has brought you the most joy in work over the last year? Amazing. Teamwork comes out so strongly here. And people and, friends, colleagues, it's all about like the personal side really. It's hugely coming out here. And that's a big part of the Joy in Work framework and kind of what Joy in Work is about as well, are these points of it. Okay, great. I think that's all of our Slido questions. So to set the scene, we are from the Royal Free London. So the Royal Free London is quite a large organisation in North London. We have 12,000 staff, 3 main hospital sites, which are Royal Free, Barnet and Chase Farm, and multiple satellite sites. And so, like I say, we ran a Joy and Work collaborative that encompassed 15 teams from across the organization. And so why is working on joy the right thing to do? And really, it's the science, it's the evidence, and we strongly believe that it is the right thing to do. So we have a huge amount of evidence now on the effect of burnout on our staff, on healthcare workers. We know that a huge proportion of our workforce are either burnt out at the moment or have experienced the effects of burnout. We know that it has a massive impact on mental health, on then how people conduct their own behavior. There's strong links between burnout and patient safety errors and the quality of care that we're able to give. So, and there's a phrase that's becoming more and more popular, which is actually we can't give what we don't have. In a caring profession, how do we give when we're burnt out? And on the flip side, there's also a lot of evidence on a happy, engaged workforce. We look to the work of, say, like Michael West, and he talks about happy, engaged workforces and how that massively correlates to fantastic patient experience. We also know that good staff experience, so we know that good staff experience leads to good patient experience. We know that engaged workforces are happier, provide more compassionate care. And we know that engaged workforces leads to a more productive organization. So it's the right thing to do on every level. So, but why joy? Why is that what we're striving for? And just as to be healthy is more than the absence of disease, to have joy or happiness in the workplace is more than just the absence of burnout. So we're striving for something a bit more here. Next. So this is the Joy and Work framework. This is what we're hanging kind of our work on. This was created by the IHI. They did a literature review of, what it takes to have a productive and engaged workforce. And they really came up with these 9 areas. And I'll let you have a little bit of a look at those. So psychological safety, having meaning and purpose, autonomy and control, having wellness and resilience. I don't think any of these 9 areas will surprise you that this is what is required to have a really happy, healthy, productive workforce. But I think what is surprising is the number of us that don't achieve all of these 9 elements within our daily workplace or within our organization. And they also created these steps to have an engaged workforce, and it's really, really simple. The first step is we really need to understand what matters to our staff, asking our staff what matters to you. We also want to identify any impediments to joy and work in the local context. And this is where the question is, what gets in the way of a good day? What are the pebbles in your shoe? Really understanding those things, and actually, can we remove any of those barriers to having a good day? We need to make a commitment to joy and work a shared responsibility at all levels. So it's our personal commitment, it's our team commitment, but it's also an organizational commitment to be able to achieve joy and work. And also we strive for joy and work using the science of improvement, because that way we can test our approaches, we can understand what works, what doesn't work, and we can use measurement in order to inform if our workforce is becoming, happier and more engaged or not. And the outcome should hopefully be improved patient experience, improved organizational performance, improved happiness for our staff, but also decreased burnout. So why a Joy and Work collaborative? Well, at the Royal Free, we'd been running our quality improvement program formally for a couple of years, and we wanted to test and apply the quality improvement methodology against one priority topic, and we chose joy and work. The reason being was that wellness was a really big priority for us. We were having problems with health and well-being, bullying and harassment, equality, diversity and inclusion that weren't being fully met, or we weren't making progress on those areas using the traditional methods. Also, we wanted to follow and build on the enthusiasm that we'd already achieved on this subject. So this wasn't totally brand new for us. And that was through running What Matters to You days. So for about 3-4 years, we'd been running What Matters to You days, asking patients and staff the question, what matters to you, to really understand people more. So, this was an approach that we were used to. People were familiar and used to asking this question, which I think really helped. And secondly, we happened to have an improvement project kind of earlier in the year that had been hugely successful. and it was to do with reducing the ICU nursing turnover. Now, Karen actually coached the project, so I'll let her quickly tell you about it.
Well, thanks, Amy. Yeah, so as you can see from the diagram, we had really high turnover in both intensive care units at the Royal Free and in Barnet Hospital. I mean, almost 43%. What you can't see here is that the Royal Free was actually 48% and Barnet with 36%. So we had a really had a big issue with turnover. And this was just, I think, at the same sort of time when we were when the Joy in Work white paper had come out that we'd seen, and we started thinking about why there was staff turnover. And we led some focus events, and we asked staff, what matters to you about your work? What matters to you? What makes a good day? What turns a good day into a bad day? What are the pebbles in your shoes? And we found out lots of different things that staff said. And as you can see, we started the project, and actually, even just after we'd asked the question, the turnover started coming down. I mean, we probably did about 20 or 30 different interventions to get this down, but we listened to staff. So there was something about they wanted more autonomy and control. They wanted to be able to pick when they came into work and not be given shifts. So we started electronic e-roster, which we'd never done before, with self-rostering. They wanted more contact with the matrons, so we opened up coffee mornings with the matrons to make them more accessible. They wanted more. In Barnet, their restroom was really outdated, so they updated that. There were lots and lots of different things that were done, lots and lots of things, but as you can see, it really dramatically impacted the turnover. And our aim was 25%, and actually we got it down to 20%. And I just looked at the figures 2 weeks ago, and it's about 13% now. And this was really important, this project, and we're still having to ask. We're still asking what matters, and you know, and in particular, the thing about what matters is you still have to keep asking. You know, the staff on the intensive care units particularly have had a really tough year or 18 months, and we need to keep asking. So it's not just a one-off, because what matters changes. So that is that's that project. Yeah, back to you, Amy. Thank you.
So, I mean, so we had good reason to focus on Joy in Work, but then how did we actually run a collaborative? So we really started by trying to build our content theory, kind of understanding the organization, what data do we already have? We took together all the data that we had from asking staff what matters to you in the What Matters to You Day, and we really built our program level driver diagram from this. And that's how we came up with our program level driver diagram. So taking the data that we already had. We then wanted to think a bit about measurement. So we did our complete review of, you know, what are all the surveys, the ways of collecting data that we can get that relate to Joy in Work. And there's tons out there. There's ones from the military, from the Air Force. And we landed on these two. So we wanted a daily measure, which was the good day measure, which is, have you had a good day at work today? Mostly yes, mostly no. But then we also wanted to use something that would give us a bit more information. So we used this adapted Gallup 12 survey. And this was a tool that we advised our teams to ask about every 3 months, and much more on a conversational approach as well. So to have slightly deeper conversations and to get some more information. We then set about organising a collaborative. So I have to say, we had about 32 teams apply from across the organisation, and we felt that we could support about 15 of them. So we had a series of learning days where we all came together. We'd learn a bit of content theory that took together Joy in Work, but also QI methodology. But there was a huge emphasis on sharing learning during those days. So we spent about half the days just going between the teams and doing kind of like poster rounds, poster presentations, so they could share learning between themselves. And then we'd have the action periods where teams would go away and do the work and then come back again. Now, we got about 2/3 of the way through the collaborative, and then, I mean, we all know what happened. COVID hit us. So the slight sad point to this story is that, you know, this program never actually, we did kind of have a celebration day in the end, but it really got interrupted by COVID. However, we did get 2/3 of the way through. We learned quite a lot. And what did we learn? So we learned that really no matter where our staff worked, that what matters is more universal than you would ever believe. And I think what really struck us was that it really related to the Maslow hierarchy of needs. So physiological needs, safety needs being really fundamental basic needs. And almost if you weren't achieving those, they couldn't progress further up that triangle in order to get like, you know, team camaraderie and those softer aspects. So things like staff just needing access to water, you know, food, safety. So, you know, to be physically safe, but psychologically safe as well, all really important. It's not just soft stuff. We tackled, you know, when you ask staff to focus on joy in work, they actually turn their attention to matters of real organizational priority. So some teams really focused on staff development. Do they have the right training programs available, making new preceptorship programs? One team, well, a couple of teams focused on recruitment, retention and staffing, and you'll hear from Penny a little bit more on that. There was a team that made some changes that really impacted patient safety and managed to reduce drug errors. And also another team focused on clinics running on time. So when they had a bad day, it's because the clinics were running late and then they didn't have great interactions with their patients who were frustrated. So they were really focusing on patient experience and clinic efficiency. But we also learned that the soft stuff really does matter. So having value and appreciation, having time with your team, really improving that team camaraderie is a big part of it as well. We discovered that measuring joy is really hard. The daily measure is tough. I think my main learning is a 3-week baseline to understand your staff satisfaction is the most useful thing you can do. We had quite a few teams say, oh, we knew it was bad, but I didn't think it would be as bad as only 40% of my staff having a good day. So I think getting that initial 3-week baseline of data is hugely important. However, keeping up the daily measure, you know, people just lost enthusiasm for it. So I think my top tip would be, you know we need to get data over time, but after your baseline, it's maybe not daily. Structures for support for improvement make a big impact. So we had our project teams, which were supported by a sponsor who was a senior person in their area who really championed their work. They had access to a QI coach who could help them apply the methodology to their project. They had regular shared learning opportunities, which was so important for them via the collaborative approach, and also using the QI methodology at the heart of this work. But what was the most impactful change? You know, it wasn't even just the projects themselves. It wasn't the outcome of the individual projects. It was the genuine, authentic belief in our organization that this is the right thing to do. It's the permission that this is so important that we need to give our staff time and permission to focus on joy. And that really comes from incredibly strong leadership within the organization. Now, what do our teams say? I'm not going to read them out, but you know, people really enjoyed being a part of the collaborative, and it meant quite a lot to them, which comes across in some of those quotes. Now, I'm going to hand over to Penny. So Penny at the time was working in the ED, and so she is going to tell you about being a part of the collaborative and some of the work that they did. So Penny, tell us about your project.
Thank you, Amy. Yeah, so I'll just take you through a very brief journey about the project that we went through in ED. So what I'll do is I'll just focus on some of the main areas of the Joy in Work framework that we used in the emergency department. And just as Amy said, I'm sure that none of these sections are new to you in terms of what you think people need. And when we look at the human side of change, but actually, yes, the amount of people that said that they didn't have this at the time was really high, and it was obviously highlighted that something needed to change. So I'll focus on the most prevalent ones during our project, and these were wellness and resilience, meaning and purpose, choice and autonomy, and recognition and reward. So I'll refer back to this framework as we go through the presentation. And just to say, with the good day measure that Amy spoke about, and we did start collecting it daily, it then did have to tail off because, again, you know, you can't keep people engaged for very long periods of time in terms of good day measures. So that's the same question. But we started off by asking staff to think about what a good day meant to them and how we could define a good day at work. We wanted to understand what good meant. Did it mean finishing work on time, having a lunch break, working together as a team? we needed an operational definition of it, and we reached out to the wider team to tell us what really mattered to them. So asking questions about what really matters to staff is we found really, really powerful in terms of bridging the gap. And so to collect some of our baseline data and really understand the size of the problem, we asked staff to complete both of these forms that you can see on screen. The one on the left included things that the staff had told us mattered to them, and in order for them to have a good day at work. And we specifically used the good day, bad day measure to inform our aim statement. So we continued to collect this data as we moved through the project, just so that we could make sure that the changes we were making were in fact resulting in improvement. So what we found was that only 52% of staff were having a good day, and we really wanted to increase this and improve staff satisfaction, staff retention and patient outcomes, among many other things. So we asked the team if they thought that having 100% of staff having a good day was realistic. So obviously we were involving them from the very start. We finally agreed on an aim statement that looked for 85% of staff to be having a good day. And in order to reach our aim, we asked staff to write down some ideas about things that made them happier at work. We collected these on post-it notes. You can see on this picture here, this is our What Matters to You tree. And we asked staff to pop an idea per leaf, which we had cut out. It was a green post-it note that we'd cut out and stuck to the tree. And every idea that they had, we then brought together to inform our driver diagram. So it allowed the team to participate, build the driver diagram themselves. It really helped us to engage a large group because they knew they were being listened to. And we decided to start with some of the changes that were low effort but high impact, so the team could see the productivity early on, and it can really help to build momentum in a quality improvement project. So staff inclusion is a key component of successful quality improvement projects, as I'm sure you know. So we ensured there were regular updates on the staff room notice board. And we even presented some change ideas on there and allowed staff to vote on their next test of change. So everybody could be included, even those who couldn't attend the meetings, bearing in mind that in ED there was a lot of pressure on the staff and people doing shift work. So a really good top tip is just have something somewhere for everybody to see, a regular update to give them really a choice and autonomy and to make decisions in the project as well. In terms of wellness and resilience, this was one of the main themes that came out of our What Matters to You tree. And so in the emergency department, this is often thought of as workplace safety, which is one of the components in the work wheel, physical and psychological safety. But for this team, joy in work meant more than the practicalities of the workplace. There was a real emphasis on wanting to find ways to manage stress and cultivate personal resilience. Some pictures here just show that in the emergency department, they practiced meditation during handovers, and this helped staff to prepare for their shift and help those that were going home to kind of unwind from the busy day. This is quick and easy. It's a really good technique that you can take into your workplaces too. We also had laughter yoga, and we had a nice relaxation space and massage chair by request of the team. So the skills that we learned during this were particularly useful in the first surge of the pandemic. As it arrived, we were lucky enough to have already started the Joy in Work project. So the staff had already started to build on their resilience, and they were learning how to manage their own mental health during times of crisis, because we had done exactly as they needed and given them what they asked for. We also recognised that meaning and purpose was key, and that staff, they really do care about what they do. They wanted to feel closer to the work and more connected. And what we realised when we asked staff what mattered or how they could have more joy at work was that a lot of their answers were linked with the trust's priorities, and actually they all had their patients at the heart of their ideas. They might have asked for more equipment or more staffing. It was always something that let them do their job better, which was really surprising for us. It was a really good link to see. So what we found was that involving staff at all times meant that the staff were better engaged and they felt valued. And as we know, if staff are engaged and feel valued and appreciated, they will perform more. We could say perform. They do better in their jobs. They're happier at work. And you always end up with better staff and patient experiences, and ultimately better patient outcomes as well. What they asked for was some time for themselves for staff development. So we implemented a day, it was a study day, and we called it Impact. And this stands for improvement, mandatory and statutory training, projects, appraisals, communication and talent seeking. This was 1 day a year, study day, allocated for each specific staff member to spend some time working on projects that they found interesting, speak to their line managers, make sure they were happy at work, their work-life balance was good enough, and to discuss any career developments or opportunities or courses that they wanted to pursue in terms of developing themselves as well. And this was really beneficial in displaying the message that we are investing time in staff and we want them to be happy at work and have joy at work. And so giving them that shared meaning and purpose. This was a really small adjustment for the department, but it meant a lot to staff and it gave us the opportunity and flexibility to try this out. So the results were outstanding. And as you can see here, I won't go into too much detail with regards to data just because I know we're short on time, but here's an example of the appraisal compliance data. So we can see that the percentage of completed appraisals was around the 60% mark at the start of impact. And we didn't manage to finish it because of the pandemic, but we did get to the 90% mark for compliance. And as we know, there is a real strong correlation between staff having appraisals completed and feeling valued at work or finding joy in work. Within our appraisals, we're asking staff if there's anything they need, if they're happy with their work-life balance. And so it really does give that person time to tell their line managers how they're feeling and what they need in order for them to have joy at work. And this is just a small example of how using quality improvement methodology and the Joy in Work framework can positively impact an area. And some of the feedback we received are on this page. I won't read them all out, but the real only negative ones were that there wasn't enough time in the day or staff wanted more of them. So we take them as positives. And there was a real positive change in the department's retention figures around 4 months into this project, and the Joy in Work Collaborative really made this possible. So finally, recognition and reward. So we recognise that staff needed to feel appreciated for their hard work. So it's important to differentiate between extrinsic and intrinsic reward. So when we say intrinsic, we mean sort of staff receive direct joy from the work that they're carrying out and they feel job satisfaction. But extrinsic motivation can be from external rewards, such as an increase in pay or a thank you party. Both are very relevant to Joy in Work, and it's just really important to find the right balance within these. What we've done, where we've talked about intrinsic reward already, this is a picture of an extrinsic reward. The team wanted a thank you party. As you know, ED staff work hard, play hard. They wanted to enjoy themselves. They wanted a big party. And so we did that for them. And it really helped with staff building relationships with each other outside of work. And they were really much better prepared to support each other during their time of need when the pandemic arrived. So just to summarize, here's a chart of our aggregated data for all our staff. We started collecting baseline data on the 29th of July, and this data demonstrates the percentage of staff that said they were having a good day at work. So anybody that had said yes to the question. So we can see a shift in our data from around the midway point of our project onwards. The Joy in Work Collaborative and quality improvement methodology played a massive role in increasing the number of good days. Unfortunately, we weren't able to continue with our project when the first surge of the pandemic arrived, but overall the team felt they had gained knowledge and coping strategies that were transferable to the new environment. We also felt better equipped as a team because we'd taken time to understand each other's working requirements better, and we had listened to what really mattered. So I think it really helped us in ED to find our common ground. So that's a really brief summary of the application of the Joy in Work framework into the emergency department. Karen, I think you also have an example to share.
Yeah, thanks. Thanks so much, Penny. And similar to Penny, I was working in a Joy in Work project. I was actually the coach for the radiology. We called ourselves Joyology in Radiology, and we had similar experience, Penny, that we had done so much groundwork in teamwork and getting together and communicating, that actually when the first wave hit, the team report is that they felt much better prepared to deal with it. But yes, I too was part of that. But I have to say that when the first surge hit, I did have to question myself whether Joy in Work was still relevant as a concept, as an idea. Was joy the right word? These are some pictures from our trust. I don't know if any of you saw the hospital program that we were featured on, and it was, as everyone knows, it was traumatic, and it was really hard and really tough for so many people and so many patients and so many families. And so I did think, is this still relevant? I believed in it before, but I have to say, hold my hands up, I wasn't sure that it still had a place in a pandemic. So I went around and I just sort of asked some staff the what matters to you question. I'm a strong believer in asking about what matters. Anybody who knows me will know that. Well, I don't really say much else. So I went around and tested it, and I asked people, what matters to you? What are you worried about? How can we support you? What's working well? And actually, people really enjoyed having the conversation, and we found this, found some results. What mattered at the time was people being kept safe, particularly themselves, but also families. They were worried about bringing COVID home. They were worried about PPE. They were worried about their morale of their team, and they were worried about lots of different things. And it was really eye-opening. And I thought, you know what, the what matters to you question really still has a place in that. And actually, I did an early sort of what matters to you survey as well. We asked the same sort of questions that we've asked you at the beginning, even in a time of crisis. And this is right at the beginning, well, middle of the first surge. Do you find any joy or satisfaction in your daily work? And you can see the figures are high. I mean, I think even slightly higher than what we've said today on this call. But this is early on. I mean, we're so many months more on now. But I thought this was really, really interesting. So you can still find, I used joy and satisfaction because I wasn't sure about the word joy, but you can see the results are pretty high. And so I just wanted to basically, a bit like Penny, think about the wheel and just reflect on some of the things that we did. I was redeployed on both waves, first wave and second wave. In first wave, I was redeployed into staff wellbeing. Second wave, I was redeployed into patient wellbeing. And just to think about some of the aspects of the wheel, how I think it's still really, really relevant. I mean, even more so now, and then some of the different things that we did. So meaning and purpose comes up on that wheel, and we had, during the first wave and the second wave this whole last year, we've all had a common goal, we've all had a common enemy and common priority, and that was really uniting for us. And I would say, if you're thinking now about setting up a joy in work project, think about what your meaning and purpose of your team is and what you are up against. I kind of feel as we have less COVID now in hospitals, we have less of a common goal as an organisation. We've all got our own sort of goals, but I do think it's really important for your team to work out what is the meaning and purpose of what you are doing and uniting around that. One other thing that came up a lot with psychological and physical safety is, Amy says, the bottom of the Maslow's hierarchy of needs, and we did lots of different things to do with that. But I guess what I'm saying, I mean, if you were doing a joy in work project now, you wouldn't necessarily need to provide be really worried about PPE like we were, but I do think you really need to think hard about that bottom rung of the Maslow's hierarchy of needs for staff, because actually it's really hard to build on that if you don't have the basics, if people don't have the IT support they need, or somewhere to sit, or they don't have the working pattern that they need. I mean, we did some amazingly extraordinary things, like the charity set up a gown factory. You might be able to even see some famous faces who were doing that, because what mattered to staff, what mattered to the organisation, is that people were safe. And so I think there were 550,000 gowns made. You can see Jude Law helping in the bottom there, which was extraordinary. But that was uniting around something that was really, really needed, what really, really mattered. The other thing that I was involved in doing was distributing some of the donations that we got in. And this is really, again, the hierarchy of needs. These intensive care nurses hadn't seen fruit and vegetables for about nearly 2 weeks, because every time they went to the supermarket, they were gone. So we And I remember walking around the wards and someone saying to me, Karen, I know people are donating donuts. I don't want donut. I want some fresh fruit. I can't get hold of fresh fruit. So we got some fresh fruit in for people. And look, this is a response. And actually, what you don't see is what happened next is all the nurses like eating raw broccoli. It was really amazing. But that's what really mattered to them. I mean, now if you brought up that, it's not going to matter in the same way because people can get fruit and vegetables in the supermarkets. But that's what mattered then. So it's really important to keep asking what matters. And interestingly, when we asked staff, we did a debrief at the end of the first wave, and we asked staff what really mattered, or in what ways did they feel supported. People did say the free food, and that was partly, I think, the bottom of the hierarchy of needs, making life a bit easier for staff in a really difficult time. But you can also see there were lots of other things that really made a difference. But these things mattered, and we asked what mattered, and the organisation responded and tried to meet that need, like lots of other organisations have as well. And there's something about what happened in over this last year about autonomy and control. And I don't know if other people have noticed it, but I've really noticed that it seemed to be more people given more freedom and trust to do things, that we were sort of like, break the rules, just get on and do it. If it really matters, just do it. There was a flattening of hierarchy in our organisation. It didn't matter what band you were, didn't matter what your previous experience was. If you could do the job, you could do it. You were doing it. And there's something about really being imaginative. And I really hope we don't lose that now as we come down into sort of a bit more business as usual, and we're all tired, and we haven't got the same common goal, haven't got the same common enemy. I mean, particularly speaking for me, I was given this amazing opportunity to set up a free supermarket. So we set this supermarket up in a sports hall because people couldn't get food at the very beginning, and we had a lot of donations coming in, and so we let people come in and take 6 free items a day, and we ran for 8 weeks, and we had 50,000 visits from staff coming, and it was the most amazing thing. But does it matter to staff? They felt cared for and looked after, and I asked people, what matters to you about this, and they said that the organisation cares about me, and that actually is making my life easier. I don't have to go home and go to the shops. When I get home, I can come here. And one lady said to me, she said, I haven't seen my child very much. I've been working so many hours, and this really matters because every night I come home, he says, what did you get from the supermarket? And I open my bag and I show him the random, there's always a random assortment of donations that come in. And that was really meaningful. So that mattered to staff. And there's something we've said as well about what teamwork means and how important teamwork is to you all, has been in the last year. And this is a photo of a wall that one of our colleagues, Nima, organised, and it was loads of the outpouring from the community come in, and people had sent in pictures. And this is all now on a wall that and what you don't know is what happens at one end, the other end of the wall. So at one end you've got where the nurses meet in the morning, where the matrons are, where they have their team meetings, and you have to walk down this corridor and you walk into the intensive care unit. It was blank before, and it was a sad walk before, and now it's a much more of a joyous, colourful walk, and people felt supported by this. And I think there's something about displaying things, celebrating the support that you can get, that you've got, and displaying your work as well. And I don't know if other trusts as well have had Project Wingman. We've still got them, they're all free, they're still with us. There's also something about doing work, looking for external people as well to come and support you, and to know what you're doing. And lots of people want to support the NHS. I think this presentation will be sent around, but if you get a chance to watch this little movie, this little video, I would. It's 3 minutes, and basically camaraderie is so important. And what we did one day was Lady Jane here, she made up a song made up the lyrics to a song, and we sang it to the nurses on Nurses Day. So this was exactly a year ago, because we just had Nurses Day yesterday, didn't we? And we sang to our nurses and said thank you. And that is really important for Joy, and it's really important for building camaraderie, and saying thank you is really, really important. It can't be underestimated. So when we asked people really similar to you, like what's gone well, teamwork was right up there. And we actually had teamwork, and then we had senior management, which I thought was a really great reflection of the work the Royal Free had done in trying to look after staff. And then Second surge, and I was redeployed. There were no donations coming in. No one needed a supermarket because we all had food in the supermarket, and I was redeployed into the virtual visiting team. So we basically had about 100 redeployed staff, and they were helping us support patients on the wards, calling up relatives, and setting up video calls. And it was really interesting, having done a Joy in Work project. I started to think, okay, well, there's two aims here. One of our aims is to try and cover the wards and enable to facilitate these calls. My other aim is really thinking about how are these redeployed staff going to feel, that they are offering up their time, they're working at longer hours, they're still trying to do their own job at the same time, they don't know what they're doing, there's no sense of real team, we can't meet up. So my aim, I had two aims. My second aim was to make sure that people who were redeployed had a really positive experience, and I worked as hard on that as we did on anything else. We had team meetings, we had celebrations, we've had WhatsApp group, loads of different things that we did to try and make sure that people felt like they were supported virtually, and I think I wouldn't have done that had I not been part of the Joy in Work programme before. And I think whatever I do now going forwards is I'm going to be really thinking about how do we look after our staff who are doing the work in a project as much as we're thinking about the project. And actually we had some really amazing feedback from staff thinking about being redeployed. We know in our first wave, because we looked at all the data, that 50% of people who were redeployed in the first wave had a bad experience and 50% had a good experience. And we worked really hard in the second wave to make sure that people who were redeployed actually felt like part of a team, and they felt like it was something that they were proud of doing and proud of being part of. Yeah, and people found it rewarding. And I think we asked them what mattered to them about being in the team, and this is what they said. So for me, there's something really powerful about always being mindful about how you can create some joy or meaning in a team that you are working in, and often it's small things, sometimes it's big things, but I will always take that with me. And I really do think that Joy in Work and the wheel and what we've been looking at is really, really important. So I'm handing back over to Penny now, thinking about her redeployment journey in Barnet.
So Penny, I'm kind of interested. So you went from being a clinical practice educator in the ED, doing your Joy in Work project, leading that really well. You firmly got the quality improvement bug, and got the role as an improvement advisor at Barnet Hospital, which is fantastic. So you had the challenge of, you moved into a brand new role, which was a non-clinical role, but then instantly got redeployed into the vaccine clinic. And you've described your Joy in Work project and how Joy in Work made your team more resilient and aware during the first surge. I'm now interested in terms of your grounding in Joy in Work. How did that impact your redeployment and how you approached running a vaccine clinic?
Thanks, Amy. Great question. So yes, it was a completely different environment, and we found that the team in the vaccine clinic were completely thrown together. So we were brand new, and we didn't know each other. We didn't know what mattered to each other. We didn't know what people's experiences and backgrounds were. And so what we had to do was go through the stages of forming, storming, norming, performing, as you do, go through all of those and just try to work out what environment we were in and who's had which strengths. So as Deming once said, was the aim for a system should be that everybody gains and not one part of the system at the expense of another. So we didn't just want to focus on giving as many vaccines as we could and then not thinking about our staff. We wanted to really link that together. And so what we done was we worked out our meaning and purpose and what mattered to people within the clinic. So we learned quite quickly that the main goals were for us all to administer as many vaccines as possible with as little waste as possible. And so what we done was we clearly displayed a number of vaccines administered per day. We had people adding comments to the board to tell us what mattered and what they found was important to them. We found ourselves finishing at 9 p.m. some nights because there was just so much workload. And so we were rapidly looking for daily improvements, bringing the working day down, changing how we compressed our bookings and how our booking system worked, And so there were lots of PDSA cycles there to improve our service. And throughout the whole way of that, we made sure we included the staff for intrinsic motivation. If we just go back one slide, I think on the top left, we can see one of the comments somebody made was they never thought that during the redeployment, they would want to jump out of bed in the morning and rush to work, which we found was a lovely comment. And really just investing in people does give people that feeling. And during the pandemic, there were a lot less limitations, and it was okay to do things that otherwise may have taken a bit of time to get through. So this is one of the many strengths that quality improvement can bring to a project as well. So in a normal working environment, you sometimes struggle to move forward with change ideas, but this really allowed for blue sky thinking and experimentation. So aside from telling us that they didn't want to stay in the clinic till 9 p.m, staff also told and that they wanted to give as many vaccines as they could in a shorter space of time. They also said that they wanted some sort of extrinsic reward. So we had arranged for some food to be delivered in. We made some certificates for the end of the clinic just to say thank you to people as a token as well. And it really does help to build with teams. I think we had a birthday as well, somebody that was working on their birthday. So we had a little party for them too. And just by following the Joy and Work framework, you're giving the team the opportunity to come up with ideas around how to make their work more enjoyable. If you link this with following quality improvement methodology, you can really empower them to test their ideas of change with very few limitations. So combining the two together, I felt was a fantastic way to create a positive working environment. And of course, we know the most joyful, productive, engaged staff feel both physically and psychologically safe, appreciate the meaning and purpose of their work, and have some choice and control over their time. So they perceive their work-life balance to be fair and equitable. In this way, you can commit to delivering a high quality care to patients, even in stressful situations.
So thank you so much, Penny. So, I mean, I think for us at the Rule Free, you know, the collaborative was the starting point, and it was the basis of really getting that real belief in the organization that this is an important thing to do, and this is something that we should dedicate time on. And every now and again, I revisit the IHI Joy and Work white paper. If you haven't read it, I highly recommend it. It's a really easy read. And recently I went back to it again, and something totally different stood out for me in it. And I think probably totally different because it's only now that I really appreciate probably what was meant by it. And so I'm just going to finish off on this. So it says, joy in work is more than just the absence of burnout or an issue of individual wellness. It's a system property. It's generated by the system and occurs organizational wide. And for me, that really summarizes the kind of the journey that the Rule Free is going on. So thanks everyone for listening to us. We've had quite a lot of questions come in, which is fantastic. And we want to spend the last 5 minutes really focusing in on those. So we're going to have a bit of a panel discussion. Julia, do you want to lead us in that?
Yes, so fantastic. That was just, it was so good. So thank you for that. It was amazing. And I think it really demonstrated the journey you've been on, but also loads of tips and discussion about how you've approached different things. I think the questions kind of fall into 3 categories. So the first one is, there were 2 questions from David Vira about the term. The first one was, the term joy has sometimes a Marmite word for some people. Did this affect people being engaged? And also the next question, also from David, was about how did you get buy-in from senior management and the board?
I'm happy to take the first one. So the Marmite thing, totally agree. It feels like quite an American term. And I think that as an organization, you've got to decide what lands for you. Some organizations choose to use enjoying work. So East London Foundation Trust uses the term enjoying work, which lands a lot better for them. In our organization, we actually asked quite a lot of our staff, what do you think of the term joy in work? And most people were really happy with it, were fine with it. So we went with it, and it was a term that had kind of already been recognized. But I have to say, when I went and talked to staff about joy in work, I always addressed it at the beginning, because if people don't like the term joy, it's already a barrier, and I find that they don't really absorb what you're saying. So at the start of any presentation, I normally actually address it and say, if joy is not landing for you, just think of it as enjoying work, or being happy in the workplace, whatever works for you. So that's generally something that I do make quite upfront when I talk to staff about it. Karen, I wonder if you want to talk about the leadership question.
I think we were fortunate that our leadership were really, really engaged at the beginning. I mean, the thing about Joy in Work is, and the framework is, it gives a mechanism for improving staff well-being, and it does give some steps, and it does give a way to do it, a method to do it. So I think we were fortunate that we had a lot of very senior buy-in. I think it helped because we had strong evidence of a big project that had gone very well using the Joy in Work project, the framework. So I think if I was to suggest, if you have skeptical leadership, maybe start a small Joy in Work project and then share the story of that and what you did, and collect your data about that. That's what I do.
Great. Thank you. So the next set of questions were really about the team setup. So the first question was from Jill Long around how many people in each of the teams did you have? And also Joe McCormick was asking, how did you choose the teams? Because you chose 15 out of, I think you said 32.
That's maybe one for me again in terms of the program setup. So in terms of how many people in each team, it's a really good question, and it's one that we bounced around because it depended on the team's own definition of who's in their team. So Penny had a team of like a couple of hundred people in the ED, whereas Karen's team, Joyology and Radiology, was much smaller. Was it about 20, Karen, or so? And so what we did for the collaborative, we had the notion of a home team and an away team. So the home team were the team that stayed at home, were running their clinical service, and the away team were members from the team that attended the collaborative. But we made it really clear that the away team, apart from the project leader, those team members should rotate each time. So everyone got a bit of learning, a bit of teaching, and got to spend some time out of the office with their team. So that's kind of how we managed it, but it was really up to the teams to define what does a team mean to them. And the 15 teams, we chose 15 because we felt that's what we could support in terms of having sponsors and coaches to actually support projects. We didn't want to go too big, accept all 30 and not be able to support the teams. And there was an application process whereby we asked questions, you know, like why do you want to do this? What would it mean for you? What outcomes do you expect? What would you focus on? And that's basically how they got selected. And the divisions and the senior leadership team also input into that. So we did kind of like a first round of looking at the teams, and then it was agreed by the senior leadership team which teams they felt would really benefit from it. So it was a bit of a joint decision.
Great. I think that answers that really well. And the last part of the section is around what would you do differently now, and what was your biggest challenge? And do you have, another question was from Hayley, do you have any tips to engage teams leaders who are sceptical about the concept of joy in work?
I'm very happy to take the question on challenges and what we do differently, because I think we were in a very high pressure environment in A&E, so it was really difficult to start engaging the team at the beginning of the project. But as Amy said, we had a team of 200. So our core team were really the ones banging the drum at the beginning to say, you know, we want to invest in you. And I think it's just once you start making those changes, so my advice would be to start on the small stuff that makes a big impact. So easy to do things that really benefit. And that way you're showing the team that actually you've listened to what they've said, you've implemented something that's made a difference. And in that way you start to build team engagement. But you're right, it can be really challenging in really busy environments just to get the team up and running. But once you get going, it's really worth it.
And you also did something really cool, Amy and Penny, as well, is when you did a change, you put a sticker on it saying this is part of the Joy in Work project. So people could walk around and look in A&E, think, oh, right, there's a massage chair. Oh, this is from the Joy in Work project. Or, oh, look, this has been changed. This is from the Joy in Work project. And I think that was really clever messaging as well, to try and highlight all the different things that you were doing.
Something I would do differently from our program building collaborative point of view is I'm not sure, we spent a huge amount of time building our content theory and building that program level driver diagram. And on reflection, and this is, I don't know if this is controversial to say, and I don't know what you'd think of this, Karen, I've never actually said this, is how useful was that? Because by doing that, we were almost assuming that we knew staff would work on, which I think we all thought staff were going to work on. I'm going to improve Joy in Work from 42% to 82%, which some teams did. Penny's team did it, and it was, you know, hugely successful. But some teams didn't focus on that at all. You know, clinic efficiency, patient safety. And so I don't know if I would kind of skip that almost. Yeah. And I also wish I knew about the measurement. Measuring's hard anyway. I wish someone had told me a bit more about practically how you measure it. And also it assumes you know what the outcome is going to be, which is, have you had a good day? Like sometimes for people, that good day measure actually didn't relate to their the outcome of their project. So I think we assumed a few things on what people would work on that we shouldn't have assumed.
That's really, really helpful. I think really there were, I mean, there are so many comments in the chat, and I think everyone should have a read of them, and they're just brilliant. But I was just wondering, oh, Jill Long's just sent another message to say, did you use any apps to measure? Do you want to quickly? Oh yes, you've answered that. So I think they were the key questions, unless I've missed anything. If anybody does have a quick question, do you want to just pop your hand up and we'll come to you? No, I think that's everybody then. That's great. That was just such a brilliant session. I can't tell you how good I thought it was. So thank you so much for coming along today and sharing that experience with you. And thank you for those of you who's joined as participants for taking the time to do that. I think we can tell from the comments that people think it's been a fantastic session, and we haven't overrun by that much, so that's always good. Thank you very much, everybody. And if you have any questions, additional questions afterwards, please send me an email. I'll pop my email into the chat. And I think that covers everything, does it, Amy, Penny and Karen?
Yeah, just thanks so much for everyone listening. Had a really great time as well. And just to say, yeah, we'll share, we're very happy to share the recording and the resources. And if anyone wants to send an email and talk about it further, then me, Karen or Penny, I'm sure all of us are very happy to have further conversations.
Yeah, just to echo that, and thank you all for having us. It's been lovely to be here.
Yeah. Thank you very much, everyone. Have a good rest of your day.
Thank you.
Bye.